Hi, I'm Nicholas Conger, and I'm an infectious disease physician. Coronavirus is a virus that has many different kinds that have been circulating in the United States and around the globe for years. There are 3 or 4 different ones that we see all the time that cause the common cold. The current coronavirus that has everyone's attention right now is being called SARS-2. The disease is called Covid-19, and it was previously called coronavirus 2019. All that means is that this is a new virus that's circulating, and the fact that it's new, most people in the world would not have any natural immunity to it. And that's what's causing people to be scared, because everyone in the world theoretically could be susceptible to be infected with it. Along with that, this one seems to have a slightly higher rate of people who get ill with this disease and a slightly higher rate of people who will actually die from this disease. And so because it's new and because everyone is susceptible to it, this was a potential virus that would cause a pandemic. And so that's what we're seeing now with transmission in multiple different countries and even up to 13 different states in the United States as of the time that we're talking today. The message to understand with this coronavirus is that, like most coronaviruses, it will most likely cause a mild upper respiratory illness in most people. So 98 to 99% of people will not get severely ill from this infection, and only 1 to 3% would be so ill that they might pass away from this. So what makes this virus different from the flu and other diseases is, while we mentioned earlier that most coronaviruses will cause a mild upper respiratory illness, in a certain percentage of people, this one will actually cause a lower respiratory illness, and it will cause an actual pneumonia. And so patients will have findings on a chest x-ray or CAT scan suggesting that their lungs are inflamed and irritated, which is leading to shortness of breath, low oxygen levels, which we call hypoxia, and that's why a few people will get quite ill from this disease. So the most common signs and symptoms are going to be fever with a cough. Some people will have muscle aches, and in particular, usually a week into the illness, if you're going to have a severe illness with this, you would start having some shortness of breath, indicating that you might be developing pneumonia. So this is spread from person to person by respiratory droplets. So we would say that contact with things that come out of someone's mouth, that they were coughing or sneezing, whether they do that in your face or they do that on a surface and you were to touch the surface and then touch your mucous membranes, which includes your eyes, your nose, and your mouth. The best ways to prevent disease then is, number 1, to try to avoid ill people. Number 2 is continually wash your hands as often as you can, especially when you come in contact with other people or people who may be ill. The best way to wash your hands is with soap and water, making sure you wash them for 20 seconds. If you don't have access to a sink and ability to wash your hands, then hand sanitizers can serve as a backup in that situation. Cleaning surfaces are frequently touched by other people or ill people can also help decrease the spread of the disease. Most people in the world do not need to walk around wearing a mask. A mask would only help prevent the spread of disease in a rare instance where someone was ill and coughing directly towards your face. Most masks are designed to prevent things from coming out. So a mask is something to be good to put on an ill person when they present for healthcare, for instance, so that they don't contaminate people in the waiting room or people in the office around them. And so it's more important to save the masks for the people who are actually sick or for the healthcare workers. But people walking around the streets, really wearing a mask won't help as much as washing your hands and avoiding touching your own face. So right now in southern Mississippi, we're seeing flu cases on the rise. And so when a patient presents with upper respiratory or even lower respiratory symptoms, it's most important that our healthcare providers assess a risk to see if they could have been exposed to coronavirus, but they really need to be thinking about ruling out influenza. Many experts are recommending that patients go out and get their flu shots so that we can reduce the number of flu cases that we see so that there's not confusion between influenza A and coronavirus if both are spreading at the same time.